Hi everyone, it's Jenn from McCreath. It's July 20th, 2016. Now that Pride Week is over, we can talk about some of the issues that should have been talked about during Pride Week, but were overshadowed. Trans health, the problems of Newfoundland and Labrador. You can look through my YouTube channel and there's probably a video each and every year of me talking about this. And that's going to be no different from this video because the problems still exist. One positive change though is, instead of one trans person speaking out or being seen, we're now seeing several, dozens, hundreds of trans-identified people publicly showed up at Pride Week at a trans march. Unfortunately, one of the messages that I was hoping to see that really did not come out, at least in the media attention, was discussion about how Newfoundland Labrador's trans health funding policies and programs are now perhaps the worst in Canada. I'm going to take a look at that policy right now and run it by you, and I'm going to talk about what needs to be done. I've seen this letter before. Government of Newfoundland Labrador, Department of Health and Community Services, MCP. There's a letter that was sent on September 2009 to me. I've blurted out my address for privacy reasons. This is a follow-up to our recent telephone conversation and your fax transmission regarding MCP coverage for patients seeking sex reassignment surgery. In accordance with the Medical Care Insurance Insured Services Regulations, section sex reassignment surgery is insured when recommended by the Clark Institute of Psychiatry, the Gender Identity Clinic of the former Clark Institute of Psychiatry is now part of the Centre for Addictions and Mental Health, CAMH. In Toronto, I've enclosed some material from CAMH website for information. The clinic requires a physician referral. Here's their information. When surgery has been recommended by CAMH, MCP ensures the following procedures. And there you have... Oh, that didn't work. Where's my mouse, damn it? So there you have it. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 10 procedures covered if CAMH recommends. Exception to this is any of the above surgeries performed in a Canadian private clinic such as Dr. Brassard's clinic in Montreal, which is not insured. So they are only insured at certain places that perhaps don't even exist. If a specific procedure on the above list is not available within the publicly funded healthcare system in Canada, application for coverage out-of-country surgery can be made. I'm going to zoom out for a minute here. However, insured services that are not granted prior approval may not be funded, or may not be funded at all. Page 2, which now we'll take a look at what is not covered. In addition, the following associated non-surgical services are insured. Psychiatric consultation, if done. Psychotherapy, if done. Following services are not insured and are not payable out of province healthcare insurance plans no matter what. And there's your list there. Chest contouring, breast reconstruction, egg preservation, hair transplant, vocal, voice, lipo, breast rhinoplasty. God, I can't even pronounce half of these things. But there they are. Anyways, so let's put the camera back on me here. Whoa, that zoom is a bit, there we go. Gotta have the wrestling belts in the background. Anyways, so there you have it. Our MCP policy, which I believe was last amended and updated in 1996. It's not even called the Clark Institute anymore. Back in the 70s, the Clark Institute proclaimed themselves as Canada's one and only expert on trans issues and trans health. So it made sense, perhaps, to suggest that trans people should attend that clinic for advice and guidance on whether or not to pursue a transition, and if so, for resource access. Times have changed. Used to be almost every province would send trans patients to CAMH for assessment before they were willing to fund transition. Now, none, except Newfoundland and Labrador. Not even Ontario, where CAMH resides, does this anymore. Ontario trans people no longer require a CAMH referral in order to get coverage for trans health services. So the question is, well, why is this policy still in effect here in Newfoundland and Labrador? Probably because hasn't been enough people speaking out asking for it to be changed, asking or complaining that it is irrelevant, obsolete, out of date, inadequate, inaccurate, etc. Secondly, what are the mechanisms to get this changed? Well, unfortunately, you cannot use the Human Rights Commission of Newfoundland and Labrador, because I already tried that. Unlike other human rights commissions in this country, ours has a very limited scope, to the point where they told me they were unable to accept a complaint against this because it fell out of the scope of their mandate. Well, we can ask the government to increase the scope of the mandate of the Human Rights Commission, say give our Human Rights Commission the same powers and authorities as other human rights commissions so that they can hear cases like this and make rulings, as has happened in other provinces. Perhaps an easier way to go about this: sue the government. We saw very publicly Kyle and Kyra Reese sue our provincial government over the rights for trans people to have ID documents changed. And there was enough public pressure and enough legal precedents elsewhere that the government felt compelled to throw in the towel and concede that they needed to change their policy because it was out of date, discriminatory, and wrong. The quick fix here is for a trans person to step up to the plate and sue the government, saying that these policies right there on my computer screen are discriminatory, inadequate, and out of date. And it wouldn't hurt to prove that they're also financially poor and politically incorrect. What can I do? Well, I could sue. I've already had all the surgeries that I feel I need to have at this point, and I've paid for them out of my own pocket. I could go and sue the government now after the fact. It takes resources to do that, obviously. I think it would be better served if a new face came forward, looking for some of the primary issues here are what's covered and what's not covered. Secondly is the barriers to getting things covered. No one should have to travel to Toronto when there are qualified doctors here in the province who can make those recommendations. 3, the limits on which clinics you can go to. Say you have to go. Even though we've got a suitable option here in Canada, we're only going to pay if you go out of country. That's not right either. Anyway, trans men top surgery seems to be a common topic that I see in this province, something that is not covered no matter what. And trans people are often forced to go crowdfunding, crowd surfing, begging, asking the public to pay for their surgery because they have no other way to pay for it. That is an option if you want to get yourself through your transition, which I understand is the primary focus of most people transitioning. There's got to be someone out there who's willing to step up to the plate. Don't just change things for yourself. Change something for everyone. Let's get these policies changed. And allies out there, there's a role that you can play. Email our Minister of Health, John Hagee. Email our Premier, Dwight Ball. Email other people that have positions of power in the provincial government's health field. Ask for changes. Give them demonstrations of how these policies provide hardship. Let's point to other policies in other provinces that are more on board and consistent with what's been deemed legally, morally, and financially correct, shall we say. Anyway, there it is. Trans people, the ball's in your court. I can sit here and post this exact same speech year after year, but the policies aren't going to get changed unless you folks also step up to the plate and ask for them. So there you have it. If you need my assistance or guidance or help, get in touch. I've got a lot of experience dealing with government policy, dealing with government complaint processes. Nobody should feel that they have nowhere to go and nowhere to turn. There are avenues to explore, and they need to be explored. Let's work together and get this out-of-date policy changed. Thank you.